Hi, my name is Alex Thompson. I will be presenting the theory of comfort. The theory of comfort was developed by Dr. Catherine Kolkaba in the 1990s. Kolkaba began theorizing about the impact of comfort while she was in school and working on a dementia unit. The theory grew and developed into a middle range theory. It is considered a middle range theory due to its level of abstract, number of concepts, and ease of application. The focus of Kolkaba's theory is in the relationship and outcomes of patients and how it relates to comfort. Comfort can exist in three forms. The first is relief, which can be achieved when a patient's needs are met. The second is ease, which can be achieved through a patient's sense of calm or contentment. The third is transcendence. An example is when a patient mentally feels that they can get through their pain to achieve comfort. My analysis of the theory is the conceptual framework is clear and can be easily identified. The major concepts can also be found easily and are well defined. The theory itself is unclear and can be difficult to follow in the literature, but the outcome is clearly identified, and my understanding of it is to utilize comfort as part of evidence-based practice. The major concepts, along with the conceptual framework, can be found on this slide. The definitions for these concepts were derived from Kolkaba's website for the comfort theory. Healthcare needs are the needs identified by patients or their families. Intervening variables are details that are unlikely to change and healthcare providers have no influence over. An example is a diagnosis. Health-seeking behavior are the actions or behaviors people have towards maintaining a physical and mental sense of health. Institutional integrity is viewed as the wholeness of the healthcare organization. Comfort, which is the sought-after result of nursing care. Nursing interventions are the different ways we provide patients with a sense of comfort. Best practices and best policies are similar and aim to provide a standard of care that is supported by evidence-based practice. This is my comfort theory evaluation. Comfort is considered a very important nursing concept. Our role as nurses should be to provide the best care for patients, and comfort is a priority. The purpose of this theory is to provide comfort to patients using nursing interventions and empirical knowledge. The theory is relevant socially and across cultures. The interventions may vary among individuals, but the patient outcome is still to achieve comfort. The theory only contains one evaluation process called the taxonomic structure, but there are many questionnaires that can be found on Kolkaba's website that can be used to assess comfort as well, and they come in multiple languages. The taxonomic structure encourages nurses to utilize subjective and objective data to identify comfort. Critical thinking skills are crucial to help understand what could also be causing discomfort while also understanding what could be providing comfort. Nurses must understand that the three senses of comfort are relief, ease, and transcendence. The sense of comfort can be achieved by four contexts, which are physical, psycho-spiritual, environmental, and psychocultural. The first example of research I found included a case study for a pediatric patient. This patient is a 12-year-old female who underwent a spinal fusion in the PICU. The taxonomic structure was created to help us better understand how to give her relief from pain, ease from pain, and transcendence. The example of physical barriers to achieving relief could be nausea or lack of mobility. Physical barriers to ease could be an uncomfortable bed, positioning, or pain. For the patient to achieve transcendence, she must have the feeling that she can tolerate or overcome the pain. The structure identifies all the context in which a patient can achieve comfort. Implications for research identified through this study would be to determine, once we understood which comfort measures worked well with children in relation to age and setting, in order to better enhance their comfort. The purpose of this article is to help nurses and healthcare providers better their care and provide care that makes comfort a priority. Another article I came across in my research was the effects of guided imagery on comfort, depression, anxiety, and stress of psychiatric inpatients with depressive disorders. This is an example of how the comfort theory can be utilized to conduct research. A quasi-experimental study was conducted on 60 hospitalized patients. The treatment group listened to guided imagery for 10 days. Both groups were given the psychiatric inpatient comfort scale and the depression, anxiety, and stress scale prior to treatment and after the 10 days of treatment. The treatment group who received guided imagery experienced significantly improved sense of comfort and also had a decrease in depression and anxiety and stress over time. Currently, I feel the utility of the comfort theory every day. In the PACU where I work, every child receives a handout prior to their procedure, asking them questions on things they like or dislike in order to provide better comfort and care measures when they wake up. Other measures the hospital has taken is putting in automated pain score reminders prior to pain medication being given and 1 hour after the medication is given, so that nurses are reminded to double check to see if the intervention provided relief of pain. Also, as new buildings are built on the campus, all patient rooms have been changed to single patient rooms. This helps to provide a more comfortable environment for the patient during their healing process. All three of the changes help promote best patient care and satisfaction, promoting the continued use for the future care. What can the comfort theory support? I feel that the theory of comfort is currently ready to support research in evidence-based practice. The theory can help to provide research on nursing interventions and their relationships on comfort. Modification will always be needed as new interventions are discovered that help better promote patient comfort and therefore better patient satisfaction and outcomes. Comfort has a huge impact on patient satisfaction. Providing patients with the best nursing interventions will lead to a patient who is happy with their care and have the best patient outcomes. Below are my references for my presentation. Thank you so much for listening. I hope you enjoyed learning about the theory of comfort.